workplaces. The Philippines is seeing the renewed spike as international scientists ask the World Health Organization to recognize that the coronavirus can spread through the air far beyond 2 meters. But can the country afford another complete lockdown if the crisis worsens? We discuss in this episode of the Chiefs. And welcome to the special edition of the Chiefs. It's Tuesday. With me right now are Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez, the head of News 5, and Robbie Alampay, who will be joining us from the TV5 studios in Reliance Street in a little while. Robbie Alampay, of course, is from One News. Ami, Lucy, any idea what the big stories are for today?
Mukhang hindi talaga magkakaroon ng tightening of restrictions kasi pati non-essential travel overseas, pwede na, papayagan na, di ba?
At tinaasan din yung mga barbershops and salons.
Yes.
With 50% of employees, di ba?
Saka may iba na may iba nang pwedeng gawin. Yung mga pakulay ba 'yon? O ano?
Yun.
Yeah, pwede na.
May mga ganun-ganun.
Lahat pwede na. So wala na tayong excuse maging puti ang buhok.
Pero it's interesting that we're loosening up some more. I remember last week it was I think it was Professor David ng Okta Research. He was telling us na nasa 1.28 na yung R0 natin, which is relatively a good number. I mean, it's not as bad as before. Pero may interview tayo today to Marian Enriquez of Professor David now saying it's now at 1.6. So tumaas ang infectivity.
Yeah.
Saka by the end of July nga daw, di ba sabi nila, baka daw umabot ng 95,590 cases by the end of August. By the end of August.
By the end of August, they're looking at 100,000. Yung by the end of July, ang sabi ni Prof. David is in all likelihood 70 and possibly 80,000.
And remember, ang isang importanteng context dyan, remember the last time we had Professor David, when we were talking about 60,000, he joke na hindi namin linolobol to, That was just, last week. Towards the end of, at the time, yung controversial, yung panalo na tayo ng Harry Roque. When they predicted the numbers for 60,000 by the end of July, they were suggesting lowball. That was a conservative estimate. Now, just a week later, after we're seeing the latest numbers, they're now saying 60, and as Ed said, possibly 70, may chance na mag-80 by the end of July.
Yes. Kahit nga yung 40,000 nila, kahit hindi naman siya tumama ng exact yung 30. In a few days, aakyat na siya. Umabot na siya ng 40,000 actually. So, hindi siya far off yung kanilang projection, Talaga mathematical projection. So, nakakatakot din yung low end nila, 61,000 by end of August. Napakataas pa rin nun, di ba? Saka, ewan ko kung yung testing natin, madadagdagan naman yung isolation. Lalo ngayon, nababawasan daw yung there's a debate on whether we will have enough hospital bed capacity.
Yun ang mas worrisome. Di ba? Although yesterday, sabi nga ni Dr. Suzy Pineda, ang kailangan daw gawin lang is to really utilize the isolation facilities. Kasi ang analysis naman niya is instead of going to the isolation facilities, yung mga natetest na positive, they go to the hospitals. So, parang kumbaga, hindi dapat daw gano'n ang reckoning. Yun ang ito, di ba?
Hindi na ma-max yung isolation facilities especially built for quarantining. People are going to the hospitals.
But that refers to what's happening dun na sa ospital. Diba? In the meantime, what people are also concerned about is everything that's going on outside of the hospitals, particularly this whole dilemma of we've started to open up the economy. We're seeing people, the staff of MRT3 being infected, having to suspend MRT3 agad because more than 100 personnel of MRT3. So as we open up the economy, even outside of what's happening in the hospitals, that's really what's representing the real dilemma for the country.
Mhm.
Wala.
Anyway,
Well,
let's bring in siguro our guest for tonight. We have several guests from the medical field tonight. We start off with Dr. Jonas Del Rosario, the spokesman of the Philippine General Hospital. Doc Jonas, thank you for joining us again, and welcome to the Chiefs.
I
yes.
don't.
Good evening, Doc.
Yes.
Kamusta na kayo? Magandang gabi sa inyong lahat. Medyo
Kamusta kamusta po kayo? Doc, of course,
Kayo?
PGH is one of the COVID referral centers. Now, the last I read about PGH was I think mga mid-June. The PGH was saying na napupuno na yung inyong COVID capacity. I think you have several wards devoted to COVID lang. I think you have 200 beds for COVID. And as of mid-June, malapit na kayong mapuno, at least several wards inyo. How's it going now?
tumataas. Actually, just to correct you, yung na-dedicate namin na COVID beds talaga na nabigay namin sa government, sa DOH, was 130 beds. No? But if we're just going to use those 130 beds, we're beyond that. Kasi ang aming census right now, we have 136 COVID confirmed patients and then about 30 plus patients na COVID suspects. So we're operating for the last 10 days, nasa mga 150 to 160. So slowly creeping up. Ang highest namin ever was 172. Tonight, we have 167 patients.
Oh, wow.
Okay. Okay,
That's
but you're saying that's a bit pa below your capacity? I'm sorry,
Yeah,
130 nga pala yung capacity nyo. So you're already above capacity.
Above
We are
capacity.
above capacity if we use the number 130. But we have buffer beds. We try to accommodate these patients. Some of these patients are actually ready to go home. A lot of them are mild already. Some of them are asymptomatic. So in some ways, we're able to transfer them to rooms that are not too demanding of the manpower. But yes, for 130, we are 100% utilization. But if we use the number 200, just in case we really need those, we're probably roughly about 80% capacity.
Doctor, kung kadadagdagan kayo, kasi sabi ng government 30% of capacity of hospitals should go to COVID cases. Kung padadagdagan at gagawin sa inyong 50%, kaya pa ba ng PGH? Kasi napakarami niyo po rin pasyente for other cases, di ba? Kaya ba ninyo?
Alam mo, parang hindi na namin willing ibigay yung 50% of PGH sa COVID eh.
Yes.
Yung 30% nga, malaking concession yon para ibigay sa COVID. As you know, PGH is really a general hospital and nakikita na
Puntahan ng bayan
natin yung COVID patients namin. Dumadating na sila, nag-lift na yung quarantine, medyo nakakagalaw na yung mga tao at nakikita na namin sila ulit, yung mga inaatake sa puso, yung mga may cancer, mga kailangan ng dialysis, marami sila. So, we have pegged as much as possible 130 beds. Yan, talagang nakakommit kami dyan sa PGH, mga confirmed COVID. And so we really need the help of other hospitals. At pati na rin yung sinabi nyo, narinig ko sa inyo, yung mga isolation or quarantine centers, they really have to be active in this decking or facilitating of patients. Kasi sa PGH, luckily, 80% of our patients are mild to moderate. We have patients who probably about 15 to 20% can be transferred already to the quarantine centers. Doon na lang nila itutuloy yung pagpapagaling. Kaya nagkakaroon ng problema kasi hindi.
Okay, Doc, linawin ko lang yung messaging doon. No? If karamihan or marami sa mga nag-take up ng capacity ng PGH have mild symptoms, what exactly is the messaging there? How ideally should people be handling their situation kung mild ang symptoms nila?
Well, these patients are mostly moderate when they came in and they are now getting better, no? So we usually get patients who are moderate to severe. And the good thing about COVID is about 85% really will recover and they will be sent home. No, now
Mhm.
the average hospitalization of a COVID patient is at least about 10 days. 10 to 14 days. So minsan, we feel like, let's say day 7 na, medyo malagaling na, halos naghihintay na lang nung day 10 or day 14. Pwede na sanang saluhin niya ng mga quarantine
Okay.
centers.
Mm.
Because if that's going to happen, then we unload PGH of those mild cases. We are now open again for the moderate to severe ones.
So may ethics ba dyan, Doc? I mean, is it right for you to actually recommend the transfer of a mild to moderate symptomatic patient to a quarantine facility if you feel that it's safe enough already? Or is there something in your ethics that actually prevents you from doing that?
No, I think the mandate of the quarantine centers is to take care of the asymptomatics to the mild. No, siguro yung moderate to severe sa hospital pa rin yan because they do not really have the full capacity, and God forbid something happens to these patients, whether they deteriorate again or baka mamaya magka-problema. Yan medyo kinakabahan yung mga quarantine centers dyan. So really what has to happen is a dedication, sort of like an agreement between a hospital and the quarantine centers, so that the quarantine centers will not feel like you're dumping your patients to us and we're not equipped. So, para ba ang dapat mangyari, the hospitals will be willing to send some of their doctors sa quarantine center or at least nira-round siguro ng hospital kahit papano para alalayan yung mga quarantine centers. If that's going to happen, then that frees up a lot of beds in the hospital.
Yeah. So who's going to facilitate a memorandum of agreement of sorts, no, between hospital and quarantine facility? Is that something that that has been initiated, in fact, or recommended at the very least?
We have raised this issue to the IATF, at we're now trying to have a MOA, and some other hospitals I think will be following suit with the quarantine, let's say PICC or the one in Ninoy Aquino. Alam mo, iba din ang kanilang mga mandate. For example, we learned that at PICC, they would like to get patients already what we call in their step down or just really recovering from a hospital. While yun naman palang Ninoy Aquino, the patients that they would like to get are community, are asymptomatics or mildly symptomatic na nag-positive dun sa community. So, we have to figure out paano yun kasi, but most of our patients obviously are coming from the hospital. So, PICC ang malamang napuntahan namin. And we understood their concerns. They want some backup from us kasi yun na nga, dahil siguro undermanned din sila. Tsaka, hindi pa rin naman talaga sila sanay na mag-alaga ng mga may COVID.
What does
Okay.
the
Doc
patient
Gian-
attorney say on it? Just wondering, if I were a patient, do I have a say on whether or not I want to be transferred to a quarantine facility?
That's a very good question. And in fact, yes, that's actually another hurdle that has to be overcome because yung mga pasyente po namin sa PGH, when we tried transferring them to the quarantine center, yung iba po sa kanila tumanggi. Siguro dahil they feel more comfortable, they are in the hospital, that's one. Siguro sanay na sila sa environment and the people that they are with. But it's a matter of explaining and reassuring them that we're not sending them there na baka mapahamak sila. Because talaga may mga ibang pasyente, literally nagbibilang lang ng mga araw, parang wala na silang sakit. But they have to fulfill or that requirement a certain number of days.
Pero Doc, who gets a final say?
Beyond the topic of capacity, it's been a number of months already since PGH was at the center of this response. What have you learned, and do we think we understand better as to how COVID is impacting our people right now? Any insights that we have now that we didn't necessarily have at the start?
Well, the way that we treated our ICU patients when before everybody was aggressive in trying to put them in the ICU and intubate them, put them in hook them into a ventilator. We have shied away from that over the past 3.5 months, we have learned that it's better not to intubate them if you can get away with it. Just give oxygen. So that's one. Second, it's still very important to keep an eye on those vulnerable patients. The elderly with comorbids, hypertension, heart disease, kidney disease, lung disease, those who are overweight, even in their mid 50s, they can be in trouble. And so, with that, I think these people are the ones that needed to be isolated, if ever, or restricted in terms of mobility. We have a lot of patients who are really able to recover. No, we have a lot of young asymptomatics. We tested our healthcare workers. We have we tested about 5,000 of our healthcare workers, employees of PGH. We tested them. We checked their RT-PCR. At least we were happy with the way that we are doing our infection control measures. Only less than 2% of our healthcare workers got infected with COVID. And in fact, there were more healthcare workers who got infected from their communities, not from the COVID hospital itself.
Doc, yung learnings na ganito and the best practices, for example, you mentioned being more conservative with intubation. That's a perspective, that's an insight that you're sharing and that is becoming standard across all hospitals and all facilities. Is that going out as a recommendation to everybody?
Right, that has been shared by a lot of doctors. We discuss COVID-19 almost every week. There are sessions, and we try to share our experiences. We learn from other private hospitals, their best practices, and I think we also have our own lessons also to be shared to the other hospitals, especially the government hospitals.
Yung mga doktor nyo, doc, okay na sila. Wala nang nagkakasakit because you lost a doctor at the start of the pandemic. Okay na sila, pati yung mga health personnel, nurses, all the frontliners, wala na.
Konting-konti na lang ang mga namatay kung meron. Alam mo, kaya siguro unahan tayo noon ay we were not really aware that some of our patients have COVID-19. So the viral load that these doctors got before was enough to really kill them. But now, in fact, ang mga doktor, kung sabihin ng iba, OA, kasi talagang full butter gear, talagang kung ano yung highest level. Now, we're really very careful. The way that we handle patients, we have to make sure that physical distancing, we have the barriers, we have all the PPEs. And then when we do operate, then if we need to, let's say there's a procedure, we have to test them first before going into like an operation, unless it's really an emergency.
Okay.
Dr. Johnston Rosario, tagapagsalita po ng Philippine General Hospital. Doc, maraming salamat po for joining us tonight.
Sige, ingat kayo ha. Nice seeing you guys.
Nice seeing you, sir.
Good night.
We will just go into a break, but when we come back, we will be talking to the doctor who wrote the book on Philippine pandemic response. Stay with us.
Welcome back, the Chiefs here on One News. Joining us in this conversation is public health consultant Dr. Troy Hepte. Good evening, Dr. Hepte. Welcome again to the Chiefs.
Hi,
Good
sir. Hi,
evening,
Dom.
Lucy, Ami. Good evening,
Yes.
Robbie,
Okay,
and nice to be here again with you.
okay,
Yes.
Doc. Now, with everything that's going on, what's your assessment in terms of starting to open up the economy? Is it too early? Is it inevitable? What's the mindset of public health experts right
Yep, I think we've heard a lot of times na no, sa media that our quarantine parang processes and procedures are among the longest yata, if not maybe the longest. But
Yeah.
I think we were really trying to calibrate ourselves if we can really have that kind of readiness, especially among our local government units. Kaya ang ginagawa natin ngayon yung national level, we'll really have to face that very, very hard issue of trying to
now?
open up our economy, our country to business opportunities, to travel, although in a limited scale. I think we've heard also that the tourism department is also planning to come up with a plan to somehow open up some of our tourist sites here in the Philippines. So I think nandun na tayo sa stage that we have to change perspective and we have to do our best efforts to capitalize on what we have learned dun sa
Mm,
past 4 months na nung pandemic response natin. So,
mm,
hoping for the best that our health facilities, our local government units, our medical community will be in a much better position now compared to
mm.
before that now that we have learned a lot really.
Yes, but
And
yeah.
knowing that we have no vaccine yet, we really have to rely on these measures that we have already in place.
Yes, but Doc, speaking of measures, over the past 4 months, we've been introduced to so many terms, from the most basic to number of infections to number of deaths. We were introduced to R naught. We're now being introduced to positivity rate and so on. What are you looking at? What for you is are the most important metrics right now to give us a real idea on.
I think we really have to concentrate on two things dun sa ating pandemic response. Overall, we have our surveillance and it informs us kung saan yung lugar, kailan nangyayari ito, at sino yung mga tao na maaring naging affected dito sa COVID. And we have good examples from our different local government units
Hmm,
where they have really tried to um, zero in on not the whole city, but on specific areas like barangays, neighborhoods, even households.
hmm,
So nagko-cross pollinate tayo with other LGUs to learn from their good practices. Having said that, yung sa surveillance, we also need to firm up our response. Yung response natin is basically very, very straightforward. We identify the cases, find their contacts, try to quarantine those contacts, and for the cases, we put them in quarantine, either at the home or in the quarantine facilities. Yung mga temporary treatment and monitoring facilities natin. We have a lot of those and they are presently underutilized. So kailangan talaga natin magamit sila. And if we need them to be seen at the hospital, we refer these cases, especially mga severe and critical cases. So that's the real way, yan yung parang how we can cope with this pandemic now that we don't have the vaccine yet. We really just have to have those measures in place and wag tayo parang pagpakakampante, not just in our homes or neighborhoods, but pati sa workplaces, mga business establishments,
hmm,
commercial establishments, and ang pinaka-importante ngayon that we really need to monitor yung nangyayari doon sa transportation sector kasi
hmm.
yung problem natin doon sa kumpul-kumpulan ng mga tao, pila-pila, kailangan talaga magawa natin ng mabuti to at talagang mag-iingat ang ating mga kababayan dito sa mga paglabas natin. Ngayon lumalabas na tayo dun sa ECQ to GCQ and then to the modified GCQ. And hopefully, we can make people go back to their work. Although maraming mga workplace arrangements siguro na pwedeng gawin from the home or from the parang may mga social distancing sila dun sa mga establishments sila or workplaces. And I think we're really in a better place now. Kailangan lang natin to see how it goes. Definitely, there will be other LGUs that will be in a parang improved state compared to the others. So kailangan alalay tayo dun sa mga medyo nakaka-catch up pa, especially in those areas in other parts of the countries na nagkakaroon na ng mga kaso na nare-report. Those LGUs or provinces or cities na nakakatanggap na ngayon ng mga returning OFWs and locally stranded individuals. So that's the thing. The surveillance and the response is key to how we will succeed in forming our plan to cope with this pandemic.
Doctor, wala pa ring vaccine, ano? And there was a study na ni-report today, reported by the Lancet. It was published in the Lancet na mukhang yun daw, yung antibody hindi tumatagal daw na nagdi-dissipate. This was a study in Spain. Kaya baka daw hindi magkaroon ng herd immunity. Anong implication natin sa mga responses natin? Kasi
Yep.
yung tayo, nagpa-plasma donation na nga tayo because of the antibodies. Nawawala daw ang bababa daw ng antibodies sa Spain.
Thanks, Amy. Important yun, yung marami kasi mga research studies, mga initial vaccine studies and trials that are being done. And there are a lot of candidate vaccines na kailangan natin makita kung effective sila or not. Pero importante yung kung dumadami ba yung antibodies for us to have an estimate or parang a gauge of kung magkakaroon ng long-term protection. Otherwise, it's like the seasonal flu. Kailangan magkakaroon tayo ng regular vaccination for this COVID-19. We have learned a lot from the influenza parang season na pag kunwari pagdating ng June or July, dumadami naman yung season ng dumadami na naman yung cases ng mga trangkaso during this time. So baka ganun din. We have to see kung we'll have to give booster doses for COVID-19 kung magkaroon man tayo ng vaccine. But it's still a little far away pa yan kasi we have to ensure na hindi lang siya effective but safe based on what our experiences are dun sa mga vaccines from the past. We have to guarantee that these vaccines will be safe when we give it to or administer it to the population.
Doc, what should we make of the information that the virus is airborne? And this information comes from the WHO itself, no? Isn't that alarming, especially as we see the numbers rising, and yet there seems to be no move, at least at the outset, that we're going to go back to stricter quarantines, no? So how should we take that information?
Yes, I think we have been doing well with our advisories for wearing masks, maintaining the physical or social distancing when we are outside. When it's impossible talaga, it's really important for us to wear those masks, at least to have that barrier or that kind of protection against the virus. So, kailangan lang talaga natin isipin na pwedeng malapitan, pwedeng maging airborne. There's a lot of studies now, a lot of information that we really need to assess kung sustainable ba yung knowledge natin about yung how we can protect ourselves against yung possible airborne transmission. They're still trying to, as far as I know, they're still trying to determine kung if it's widespread or it's in special circumstances like in the hospitals where we have yung tinatawag ng aerosolization, nagiging aerosol yung virus or yung pagkalat ng virus kasi dun sa mga procedures na ginagamit nila like the suctioning and sa paggamit ng mga ventilator. So it's something that's still something na kailangan pang gawa ng studies and ma-establish natin yung evidence for this.
What about the projections? Like we were just talking about it earlier, no? There's a projection that we might reach 100,000 by the end of August and maybe even upwards of 60 or 70,000 by the end of this month. How should we take that, given that the government is set on maintaining the quarantine levels at this time?
Yeah, if that were so, we have to really parang try to predict or try to come up with an idea of how that will happen. Kung mangyayari yan, I guess that will happen in our metropolitan area, especially here in Metro Manila, sa National Capital Region, and probably where we've seen it grow, yung mag-evolve in the past weeks dito sa Cebu City. We're hoping that it won't happen in the other bigger cities of the Philippines, pero if that happens, bale, talagang dadami exponentially yung kaso natin. But having said that, kailangan natin maalala na hindi mangyayari to kung hindi natin makikita muna kung saan siya nang gagaling dun sa level sa local, dun sa mga barangay or neighborhoods. There are a lot of parang initiatives now. Some of them are using technology. Some of them are trying to maximize yung ating RT-PCR to also cover those who are living in the community. I think Secretary Vince Dizon, our Deputy Chief Implementer for the COVID Task Force, alam ko na they have that in the pipeline na magkakaroon tayong testing for the asymptomatics so that we can estimate how we can try to look at yung transmission within the communities. Before kasi we had very limited means to test people, and we only reserved that for patients, those who are symptomatic, the healthcare workers, maybe the frontliners. Now, we have to expand further yung ating mga, kung sino bibigyan natin ng mga tests. The RT-PCR and rapid diagnostic test will have to be complementary to each other. It's still the RT-PCR, yung ating gold standard, but for those who might be undertaking studies in the community, for us public health professionals and colleagues, gusto namin malaman talaga kung ganong kagrabe yung infection or yung prevalence or incidence of COVID-19 virus infections in the community. So, kung doon nagmumula, dapat unahan na natin siya. If this were a race, so virus versus people, and I'm putting my my bets on us to be able to organize ourselves so that we can really preempt or maybe try to prevent na mag-escalate ito to that so-called estimate of 100,000. Hopefully we won't be
Doc, malinaw naman yung Doc, malinaw naman yung message nyo. I think you've been very consistent in emphasizing that the most important thing for you is our response. But I would still like to revisit my question earlier about the trend. And just so people have a sense of where we are and where we're headed. For the past 3 days, especially mataas ang site because we're looking at absolute figures. 2,400 one day, 2,000 the next day. Now we're at 1,500 new cases today. But government also emphasizes na no, this is a function of more tests and therefore inevitably tataas. Where do you stand on reading the trend? I mean, and how do you qualify it? How do you qualify it for people? Where are we in flattening the curve if we are in fact doing that? And how would you quantify the absolute figures that people are seeing?
I think it's the usual narrative where we have our public health experts, our experts from the DOH and from the government telling us that tumataas yung capacity natin kasi for testing, and that's why we have increasing numbers. But having said that, we have to take it in context where we see yung increasing numbers. The numbers are being reported not just from the community, but in hospitals. Kaya importante na ang DOH, they give us that information, yung how much natin nagagamit yung ating mga facilities, yung critical care utilization rate natin. It's something that we need to really monitor, especially if, like in Cebu City, and I guess some of the hospitals here in Metro Manila, tumataas na naman yung number of cases nila and those who are getting admitted to these facilities. So we have to look at it all together. Yung rise of cases, yung epidemic curve natin, where we see a steep increase. I think more testing kasi is good for us, but also we also have to look at yung positivity rate, whether it is going up or down or medyo a little may range siya na naglalaro between 6 and 7%. I think I can't remember if it's WHO or CDC or both have recommended that if it's below 5%, that means it's okay for us to gradually open our quarantine measure. So medyo nasa same script rin ng DOH natin with our...
So where are we on the positivity rate? I mean, so where are we on the positivity Is it going up? Is it stable? Are we
Yeah.
within that the standard?
More or less nasa 6 to 7% siya. If we see a decrease, that means we are testing more people, and nakikita natin na um, parang pag konti na lang yung positivity rate, ibig sabihin maraming nagne-negative. So we hope we can reach to that point na dun sa mga ibang countries where they are testing millions and millions of people talaga. At the one of the meetings that I've attended, I think I heard Secretary Vince Dizon that I think by June 2021 we should try to reach 10 million that will undergo testing. So we have to get to that point na steady lang tayo dun sa testing so that it will guide us. So para malaman natin kung ano ba yung akyat and baba ng mga cases natin. But we also have to remember that tinitingnan natin yung admissions to facilities, to our hospitals, yung paggamit ng mga ventilators, yung pag-admit sa mga ICU ng ating mga COVID cases, yung paggamit mismo ng mga quarantine facilities, yung TTMF, yung temporary treatment and monitoring facilities. These are important there for us to gauge kung we are doing well in contact tracing so that we can contain yung mga cases natin to specific areas. Otherwise, mangyayari sa atin yung nangyari early during this pandemic when we had yung sustained local transmission here in Metro Manila. So hopefully we won't get back to that. But if we have a rise of cases, we have to really go granular. Ayun na naman yung term na kailangan talaga natin makita sila kung saan sila nagmumula. And this is only possible if we can work with our local officials, our health officials at the ground, and also with our local government officials so that they can be more informed of what the operations are and ano yung process nila of trying to improve yung kanilang measures in their communities.
Doc, yung binabanggit yung June 21 or July 21 na 10 million target of testing. Anyway, it's July 21 and then are we anywhere near 10 million? Where are we now?
I think we're going to breach 1 million yata. I'm not sure if we have, no? Pero I'm pretty sure that accelerated kasi yung ating test. We have all instrumentalities yata of government helping talaga sa testing. And it's also in partnership with the private sector, with our international health agencies, our partners, to guide us kung paano ba natin masusustain ito. Kasi nag-accelerate tayo kasi with the testing. We have a lot of labs, nasa around 70 laboratories na yata tayo na accredited. And remember, before we only had like RITM and quite a few laboratories lang. I think we only had 5 at the initial, na yung pag-mount natin response. So, kailangan talaga natin, i-sustain 70 labs and plus more pa. Kasi dadami pa yung capacity natin dapat in the provinces. So, we have to have that kind of network. And I think I need to emphasize then that important yung reporting. Our laboratories are important partners for us. So, without the laboratories providing us with the results, tumatagal yung ating mga information. Kaya, we need to really have a better way, a better system. And I think they're addressing it now also, yung tungkol dun sa information systems nila.
Mm-hmm. Doc, one more question, Doc. Earlier we were talking to Professor Guido David of UP Octa Research. Of course, he's not a doctor, he's a mathematician. But last week he was saying kasi na yung R0 natin nasa classico somewhere around 1.28. But today, in an interview today with the News 5, ang sabi ni Professor David is now at 1.6. I'm wondering if you're getting the same numbers, and secondly, I'm wondering how you look at that number, if that is a correct number. Is that a number to be worried about?
Yeah, yung R0 kasi is, as we already know, it's a way for us to see kung talagang dumadami ba yung infection.
Apo.
If the R0 is 2, parang dumodoble yung kaso. Pero if it's less than 2, kung nari 0.6 siya, so parang magkakaroon pa rin ng transmission. If it's 1, so at least parang paisa-isa lang. Sana kung pwedeng less than 1 eh. Pero yun, kailangan talaga natin makita kung sustained ba yan. Much like yung positivity rate, there's a variation over time. We have days where it's higher, we have days where it's lower. Yung 1.2 or 1.6, I guess it might vary. So it's important for us to keep it there. And if possible, pababain pa natin siya. But as in any kind of analysis, ginagawa natin dapat ito not for the entirety of Metro Manila or for the regions like in Region 7 or here in Metro Manila sa National Capital Region. We have to look at the RNOTs at dun sa pinapakita rin ni na Dr. Guido na maybe at the city level. And then let's see whether over time we have to compare it from this week to the past week and to the succeeding weeks kung na-maintain ba niya yung ganung numbers. So there has to be a lot of effort in this. We have a lot of analysts, data scientists. We have our statisticians, epidemiologists, mathematical modelers to help us interpret all of those figures. But if it's overall, I would assume na may 1.6, maybe higher, 1.8 pa for some. And then there are some that might be at the lower level, so 1 or 1.1 lang. So the variation is there, and we just have to see whether we can address the problems as they arise. Ang problem kasi sometimes ang attack natin pangkalahatan eh. And when it's that way, kung generalize, our
Yeah, parang
efforts will
shotgun.
be parang spread out and it might be too thin dun sa response natin. So we have to be effective and efficient, Ed.
Okay. Well, Dr. Troy Hepte, I suppose we could call you the country's top epidemiologist.
Oh no.
Maraming salamat po, Doc. Thank you for
Salamat,
joining us,
Doc.
Doc.
Thank you.
Thank you. Thank you, everyone. Stay safe po.
You too.
Well, we
Okay.
will just go into a break. Please stay with us.
Welcome back to the Chiefs. We're now in the final stage of our conversation, and joining us now is Health Undersecretary Maria Rosario Vergere. Good evening, Yusek Vergere. Good
Evening
evening
po.
po. Can you hear us
Good evening
now?
po.
Good evening
Yes.
po.
Okay. Clarify lang natin kasi there's a lot of confusion about the state of our critical healthcare facility. Do we have enough beds? Yun ang pinag-aawayan eh. Yung meron ba tayo daw enough ICU beds, enough general isolation beds? Ano bang status natin ngayon?
Yes, ma'am. I just like to make it clear, no, because yesterday there has been this reports coming from hospitals that they are in full capacity. So
Yes.
what the Secretary of Health did was we called for a meeting among the different hospitals in Metro Manila, and we wanted to clarify this issue. So first, we'd like to clarify that if a hospital will declare that they are in full capacity, this is with regard to the allotted beds for COVID.
Mhm.
And this is not the entire hospital because people are panicking and thinking that there are no beds anymore available in our hospitals in Metro Manila. So when the
Yes.
secretary discussed this with them, we found out that some of our hospitals in Metro Manila cannot really comply with this standard of 30% that has to be allocated with regard to their beds in the hospital. There were a lot of reasons, and these were all understandable. Like for example, if you need to have the 30% allocated beds, no, based on your authorized bed capacity, you need to close down a unit. Which, for example, if that unit previously contains 10 beds, you can only put there 5 beds now because of physical distancing or the distance between the beds. So these were the things that were discussed yesterday, but we are clarifying that our hospitals still have available beds, isolation beds and ICU beds, and also mechanical ventilators are still available within Metro Manila.
Mhm.
Doc, you
So
said,
these are only for so this is only for COVID-19 capacity. It is not the general population of beds in the hospitals we're talking about.
Right, right. And in fact, the Chinese General Hospital and even St. Luke's Center, a medical center, has issued these statements last night and this morning where they were clarifying the internal memos that they have sent to their staff, which apparently leaked out. That it is really not the entire hospital that is full and they still have capacity to accept patients.
on the other hand, you said, we just interviewed Dr. Jonas De Rosario of PGH, and he confirmed actually that as far as the COVID bed capacity is concerned, they've actually already uh, allotted more than the 30% share that they have committed for COVID. So, in short, even the utilization is already at max, if not over max.
Yes, ma'am. Actually, we have to understand that because PGH is a COVID referral hospital. We have assigned three hospitals in Metro Manila at the outset of this response to become our COVID referral hospitals. These are PGH, Lung Center of the Philippines, and the Jose and Rodriguez Memorial Hospital. So definitely more patients will be going to them, and definitely they will be receiving referrals coming from other hospitals within the metropolis. So ito po yung estado. Kapag ang PGH po lang center, talaga pong lagi po yan, meron tayong to the max sila because they are COVID referral hospitals. But what is good here would be they have surge capacities. They can expand progressively, not just the COVID referral hospitals, but the other hospitals as well. They were instructed by the secretary that if and when there would be increasing cases, that they have to expand and have additional 20% surge capacity.
Okay. Ma'am, while you're here, maybe we could take advantage of your presence to clarify something's happening in Metro Manila, particularly with specific cities. You have clarified, for example, an earlier report that identified Marikina, Muntinlupa, Makati, and as emerging hotspots. You've said it's not true. At the same time, we take note that in a clarification, you also said that you are closely monitoring the situation in Quezon City. Where are we right now with regards to these cities? And just to clarify it for
Yes, sir. Actually, last night I had to apologize because it was included in my script yesterday regarding this four cities that when we tried to verify, it was a month ago na data. So we had to
Mm.
apologize to our city mayors, and also we had to rectify last night. So it
Mm.
was really that these cities were really not on that top list of where cases are increasing. And actually, the three cities had decreasing numbers. That
Mm.
was Marikina, Muntinlupa, and the other one. Now for Quezon City, we just said that we are closely monitoring because they still have this number of cases that has to be really monitored.
Mm.
Along those lines, Yusek, can you assure the public that we're not at a point where we're seeing an emerging second wave?
Um, we are not saying that we are already having that second wave. We are just saying that numbers are increasing and we are not going to deny that. We have increasing trend of numbers since about 3 or 4 days ago. And then when we started analyzing our numbers, this increases was really started in the middle of June, starting with what happened with Cebu and then with the other regions that are slowly having cases. And now in Metro Manila also, we have observed and noted that numbers are also increasing. So numbers are increasing, but we really cannot say yet that this is a second wave. What we are trying to make the general public understand would be that there are these trends that we are analyzing right now, and it really shows that numbers are increasing. We have somehow expected this because we have eased out on restrictions, but we were banking that we will be ensured that the cases won't rise this much because if we only will be implementing the minimum health standards. And I think that's one of the things that we are right now in our implementation of these response.
Well,
You sir, is there any concern in the DOH that the economy might be reopening too quickly? Because there was a spike in cases, for example, in the MRT3. You need mass transportation for the revival of the economy. Is there that kind of concern among DOH officials?
Oh, well, when we look at this, ma'am, when we try to give recommendations and discuss it with the interagency task force, it would always be not just health, but we are also looking at the other sectors as well. And part of that would be the economy. And one of the things that we have considered very well when we tried to recommend the easing of restrictions in some parts of the country was people now are getting ill, not just from COVID-19, but also from the effects of having no food on their plates. So that's one of the reasons why we needed to have that kind of recommendation. Although one of the safeguards that IATF has provided would be there would be this authority of our local government units if they find that a certain area in their locality would have increasing cases, that it can be, that they have that authority to lock it down so that we can contain the transmission.
Hmm.
Ma'am, yung binanggit po ninyong you've noticed that people are also getting ill from not having food on their plates. Can you be a bit more specific? Can you elaborate? What exactly are you talking about? What kind of illnesses and by how much?
Yes, it was pointed out to us, and even if even within DOH, we were discussing, no, before the COVID-19 pandemic started, we already have about 30% of children who are stunted, and we
Mm-hmm.
have much also who were malnourished. So we were
Mm-hmm.
thinking and we were monitoring, and we do not want that this be aggravated further because we all
Mm.
know that when you are malnourished or a child is malnourished, you are very uh, you have a that high risk, no, of getting other
Opo.
diseases. So that is
Mm-hmm.
one of the things that has been considered during that discussion.
Mm-hmm. But have you
Ma'am,
noticed any
speaking of
significant increases in those numbers?
We are still trying to analyze that based from the reports that had been given to us. We will be giving information in the coming days.
Ma'am, speaking of things that can aggravate and that are being aggravated, we are already in the rainy season. As we know, with the water In the wet conditions, we get a lot of seasonal problems as well. How are we braced and ready for all the things that we usually anticipate during the rainy season, given uh, how burdened our health sector is?
Yes, sir. Actually, when this response started, one of the things that we made sure of was that essential services would still continue. That's why our goal in this response is to reduce COVID-19 related deaths and non-COVID deaths. Meaning, our essential services has to continue specifically for those priority programs that we have, and that would include these programs that really would have this kind of increases during rainy season, like dengue program and the other waterborne diseases, leptospirosis. So our programs are there. It is being implemented. We are educating the public regarding this matter so that we won't have other complications or other illnesses that would be increasing aside from this COVID-19 that we have right now. So essential services are there, and we are hoping that people are also accessing the services aside from the COVID-19 services that we provide.
Yusek, do you find a bit more difficulty in conducting contact tracing, especially in places like the MRT3, where you will have where the cashiers themselves, I believe, or some of them, are the ones who actually were found positive. So this or these cashiers were the ones who actually directly had contact with passengers. uh, when I just think about the contact tracing in that kind of magnitude, you're talking public transport and so many passengers that may have been infected. How do you address that contact tracing challenge of something like that?
Yes, Lucia, we are not denying it. It is really a challenge for us, no. But one thing that I like to inform everybody that contact tracing now is being led by DILG. But of course, our local health officials are also helping, and we are also providing guidance. One of the things that we saw that could really help us in this kind of situation would be to announce that the MRT already has this number of people who were affected, and these were the people who were assigned in this specific work or task in the MRT. And so that people will voluntarily isolate themselves whenever they have symptoms or experience symptoms, or would voluntarily call the hotlines of DOH and DILG so that we can be able to identify them, and we will be able to continue on with our contact tracing. But yes, we cannot deny that it is really a challenge for us.
It's like how are our other health programs? Like the immunization, they need to follow a certain schedule, di ba? And parents are worried about bringing their children to immunization centers. Ano yung impact ng COVID to our immunization program, for example, for measles, for the childhood illnesses?
Yes, ma'am. Actually, even before COVID-19 started, we already were having issues with our immunization program, specifically this program that we have for our kids, no, the infants, the less than 1 year olds. And now that the pandemic has started, no, and we have this kind of situation, we are already again, no, facing this kind of challenges. But what we have done, because we understand that mothers are really scared of going out of their houses and even bringing their children to our health facilities, so we have devised different strategies so that we can be able to make them access our services, like having these stations near their houses, having house-to-house immunization schedules, and also assuring our mothers that when they go to the health facility, it's not going to be like before, where there are a lot of people. They are being given schedules. We do not limit our immunization day or immunization schedule to just 1 day, as what we had before, every Wednesday. We now have different days to provide immunization for the children, so that it will be more accessed by the mothers, and immunization rates would also increase.
There are also reports that the HIV program was affected. Is this true?
That
Because
is
it's
you, ma'am. Yes, ma'am. I'm sorry. We already have provided that information this afternoon in our presser because people were saying that because the antiretroviral drugs were included in the solidarity trial that we are going to have this shortage. No? So I like to inform the public we do not have any shortage of these ARVs or the antiretroviral drugs for HIV because we have procured and stockpiled and we have stocks until next year. And we also have other procurements for this kind of drugs. Now, this access of people with HIV, what we did at the outset was to give our HIV patients a stockpile of their drugs so that they do not have to go every month to the facilities where they get their drugs so that there would be minimal going out of these HIV people because we know that they are immunocompromised and they are vulnerable. So we wanted to take care of them by giving them 3 months or up to 6 months supply of their drugs.
At this point, if you put together the hospitals and the quarantine facilities, where are we in terms of reaching the critical care unit metric that we have set as a standard for saying that, well, we should, tighten quarantine levels again?
Yes, right now we are at that moderate risk when we talk about our critical care resources. So for the Philippines, we have about 38% critical care utilization, meaning for the whole country, we still have about 62% which is reserved and which can still be used and available. Now, when we talk about the National Capital Region or Metro Manila, we already have about 63% utilization. So we are left with 37%, and that is moderate risk already. That's why the secretary, when we had a meeting with our hospitals during that time that I said, has instructed our hospitals already to start decongesting. How do we decongest? We send our mild and asymptomatic patients to step-down care facilities so that they will congest our hospitals because we have observed that some of the hospitals are still admitting mild and asymptomatic patients when in fact they are supposed to be in temporary treatment and monitoring facilities and only severe and critical cases should be admitted in our hospitals.
What if the patient does not want to go to a quarantine facility?
Well,
What
there
if
would
they
be.
prefer to be in a hospital?
Yes, there would be patients who really are requesting that they be admitted in hospitals. And these patients naman, when we try to analyze, would be those patients with pre-existing conditions. So most of the time, it is justifiable. But if you do not have any existing conditions and you have a mild form of the disease or you do not have symptoms, it is just proper that you be quarantined in a temporary treatment or monitoring facility. Or if you like, you can stay at home as long as you have your own room and you have your own bathroom and you will be monitored properly by the officials.
All right. Thank you.
Okay. Health Undersecretary Maria Rosario Vergere. Ma'am, we know you're always busy. In fact, you're on TV more often than we are. But maraming salamat po for what you're
Maraming
doing.
salamat po.
Maraming salamat po.
Thank you.
Thank you, ma'am, and good night. And that's our wrap for tonight. You can also catch One News on the Signal Play app. Register for a free account at signalplay.com and stream One News live anytime, anywhere. That will be all for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. I'm Edwin Gao of One News.
I'm Mami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay and we are One News.